Hello, my name is Loretta Udro. I am a family nurse practitioner candidate at South College, and this is a video case presentation of an actual patient encounter I had during clinical rotation. The patient presented to the clinic with a chief complaint of, and I quote, "I have severe pain here," pointing to her left chest. "It comes and goes, and when it comes, it goes down to my left arm." And this is her history of present illness. She's a calm 53-year-old Hispanic female who presents to the clinic reporting intermittent pain in her left chest, which she feels behind her left breast and radiates down her left arm. She reports the pain started about 2 weeks ago while she had been sitting in her living room couch and decided to lay down on the couch. The pain abruptly occurred as she tried to go from a sitting to a laying position. She describes the pain as sometimes sharp, sometimes dull and achy, and sometimes feeling like a lot of pressure on her chest. The pain lasts about 10 minutes when it occurs, and then nothing in particular triggers it, as she has experienced it several times since the initial episode. She reports that the pain seems to get better with rest. She reports no other symptoms, including shortness of breath, dizziness, palpitations, peripheral edema, or nausea and vomiting. And she says sometimes she takes ibuprofen when the pain occurs, but she's not sure if it helps. So she decided to come to the clinic to get evaluated because she also has a family history of heart disease and she's worried something might be wrong. Upon review of the patient's cardiovascular system, in addition to other body systems, she denies palpitations, dysrhythmias, or peripheral edema. She, however, endorses left chest pain that radiates behind her left breast and down her left arm. A little bit more about her history. So her past medical history includes hypertension and also infection of the COVID-19 infection, which she had on March 13th, 2023 and August 20th, 2023, respectively. She has no other significant past medical history she reports, and she has no surgical history. Her family history includes heart disease, hypertension, type 2 diabetes, and thyroid disease. Personal and social history involves being a heterosexual woman who has been married to her husband of 23 years and has 2 children. She lives in a single-family home with her husband in Concord, North Carolina. She has no current use of or history of smoking or using tobacco products, and she drinks socially and denies use of illicit drugs. She is a high school graduate who used to work in a grocery store as a cashier, but now she works or she cares for her grandchildren as a full-time nanny. On physical examination of the patient, she has a normal S1, S2 heart sounds. A 12-lead EKG completed shows a normal sinus rhythm and a heart rate of 77. She had no murmur or gallop and no carotid bruit. Her pulses were within normal limit at 2 plus, and her capillary refill was less than 3 seconds on all extremities. She had no signs of edema in bilateral extremities. On palpation of the left chest, she grimaces in pain, and when asked to lift that left arm up, she grimaces in pain, although she's able to complete the task slowly. Medical decision making. So based on subjective and objective data, probable differential diagnoses include costochondritis, acute coronary syndrome, pulmonary embolism, and pneumothorax. A review of her labs indicate no abnormalities with her troponin levels or any discrepancy with any of her CBC lab levels. A review of her EKG again notes a normal sinus rhythm, ruling out any dangerous acute cardiac problems such as MI, which has a mortality rate of 11.7 1 year post-MI, as asserted by Muzaffarian et al. Diagnosis was costochondritis, and this was based on subjective and objective data, including assessment data gathered, history, and medical decision-making analysis. The medical diagnosis for this patient is costochondritis based on these factors. The treatment plan included a recommendation and prescription for ibuprofen 600 milligrams 2 to 3 times a day and as needed for the pain that she was having. Other recommended home remedies included rest, applying ice pack or heating pads to the area on the chest or against the chest, She was also advised to follow up in the office if symptoms worsen or persist after 3 to 6 months, as this condition takes several months to resolve. This encounter took place on September 7, 2023, and a signed documentation was completed with my preceptor co-signing to indicate approval of the service provided. And this is the end of my case presentation. Thank you.